Here is a detailed explanation of norepinephrine. 1. Generic name, drug class, drug forms, brand name. Norepinephrine, drug class, vasopressor, sympathomimetic amine, alpha-beta-adrenergic agonist. Drug forms, injectable solution, IV only, concentrated ampoules or vials that must be diluted before use. Brand name, Levofid, most commonly used brand. 2. Definition, norepinephrine is a potent vasoconstrictor used to treat life-threatening low blood pressure, hypotension, particularly in the setting of shock. It mimics the body's natural neurotransmitter and hormone norepinephrine, working on both alpha and beta adrenergic receptors to increase vascular tone and blood pressure. 3. Mechanism of action. Alpha-1 adrenergic agonist causes intense vasoconstriction of blood vessels, increasing systemic vascular resistance and raising blood pressure. Beta-1 adrenergic agonist mildly increases heart rate and cardiac contractility, leading to improved cardiac output. Little effect on beta-2 receptors. Minimal bronchodilation. Result, increased mean arterial pressure, MAP, enhanced organ perfusion, stabilization of circulation in hypotensive states. 4. Indications, norepinephrine is indicated in acute hypotensive states, e.g. septic shock, neurogenic shock, cardiac arrest-related shock, severe hypotension not responding to fluid resuscitation, adjunct in cardiac arrest to improve perfusion after ROSC, return of spontaneous circulation, vasodilatory shock unresponsive to other agents. 5. Contraindications. Do not use norepinephrine in hypovolemia without prior fluid resuscitation, mesenteric or peripheral vascular thrombosis, due to risk of ischemia from vasoconstriction, pregnancy, relative contraindication, patients taking certain general anesthetics, e.g. halothane, cyclopropane. 6. Precautions. Before taking this medicine, ensure adequate blood volume, correct hypovolemia first. Use with caution in patients with cardiac arrhythmias, hypertension, hyperthyroidism, diabetes mellitus can increase blood glucose, arteriosclerosis, elderly patients. Extravasation risk can cause tissue necrosis. Use central line whenever possible. Pregnancy and breastfeeding, use only if benefits outweigh risks. 7. How to use. Administered intravenously, ideally via central venous catheter. Must dilute before use. Mix the prescribed amount in 5% dextrose or normal saline. Continuous infusion with infusion pump required. Monitor vital signs, BP, HR, continuously. Do not inject intramuscularly or subcutaneously. 8. Dosing information. Adult dosing typical. Initial dose, 8 to 12 milligrams per min IV infusion. Maintenance dose, 2 to 4 milligrams per min, titrated to maintain adequate BP. Usual max dose, up to 30 milligrams per min, based on patient response. Always titrate to systolic BP 80-100 millimeter Hg, mean arterial pressure MAP 65 millimeter Hg. 9. Missed dose, overdose. Missed dose, not applicable as it's a continuous infusion in a monitored setting. Overdose symptoms, extreme hypertension, bradycardia, arrhythmias, headache, restlessness, tissue ischemia, especially in fingers, toes, kidneys, or intestines. Management of overdose, stop infusion immediately. Supportive treatment. Phentolamine, alpha blocker, may be used for extravasation or severe vasoconstriction. 10. When to stop or avoid taking. Discontinue gradually after achieving hemodynamic stability. Avoid abrupt discontinuation in patients still dependent on pressors. Stop if severe hypertension or arrhythmias develop. There is evidence of organ ischemia, e.g. decreased urine output, abdominal pain. 11. Side effects in detail. Common side effects. Anxiety, headache, nausea, sweating, paleness, tremors. Cardiovascular. Reflex bradycardia from high BP, palpitations, arrhythmias, chest pain, angina, hypertension. Vascular. Peripheral vasoconstriction. Reduced blood flow to limbs, kidneys, and GI tract. Tissue necrosis if the drug leaks outside the vein, extravasation. Respiratory. Dyspnea, shortness of breath, pulmonary edema, rare. Others, hyperglycemia, metabolic acidosis, insomnia, or agitation. 12. Vital information. Always use central line for administration to avoid extravasation. Continuously monitor blood pressure, ECG, urine output, peripheral perfusion, Keep antidote phentolamine ready in case of extravasation. Fluid resuscitation should precede norepinephrine use in hypovolemic patients. Do not mix with alkaline solutions, may inactivate the drug. Protect from light, drug is light sensitive. 13. Other drugs that will affect norepinephrine. Increased effects, risks. MAO inhibitors, e.g. phenelzine, tranylcypromine, can cause hypertensive crisis. Tricyclic antidepressants, e.g. amitriptyline, increase norepinephrine action. Linezolid may increase blood pressure or serotonin syndrome risk. Ergot alkaloids, additive vasoconstriction. Anesthetics, halothane cyclopropane, may increase arrhythmia risk. Decreased effect. Beta blockers may blunt cardiac effects. Alpha blockers may reduce vasopressor effect. Thank you. Have a nice day.